From Flourish DX, this is the Psych Health and Safety Canada podcast, with workplace mental health becoming a priority for businesses who want to retain staff and prevent burnout. This is the source of information for creating sustainable and psychologically healthy workplaces in Canada.
Welcome to Psych Health and Safety in Canada, and today I have somebody with me who was my co-chair when the original development of the National Standard of Canada on Psychological Health and Safety was developed. And it was such a pleasure to work with him, but you're going to learn a lot about who Roger Bertrand is, all of the experience that he brings, and all of the work that he's doing still today to make a difference in this field. So welcome, Roger, and I'll get you to tell people about your journey, where you came from, how you got started, and where you are today.
Okay, well, thank you, and Marianne, for having me. It's really a pleasure to have the opportunity to share some common priorities dealing with workplace health issues, and so I'm going to try to be as clear as possible. I'm in an econometrician. I had first a bachelor degree of Laval University in 1971 already, and then a master in econometrics. And from there, I went first in a statistical agency, the Bureau de la Statistique du Québec, which is in Quebec, the same kind of body as we have all over Canada for Statistics Canada. Okay? And I had the opportunity to observe a lot what was going on in various sectors of economic activity, as well as in the health sector. And from there, I became in 1980 a director for health and social services budgets at the Treasury Board in Quebec, which was for me very interesting because it was at that time about 1/3 of the overall budget. And what we discovered when we analyzed the evolution of health costs in Quebec, it was that we couldn't control the expansion of health costs and social costs as well, if we were still continuing like that, this is why I was appointed as vice chair of a very important royal commission, the Commission Rochon, with the mandate to examine and try to find solutions about the financing and the functioning of the health system in Quebec. And for me, it was a kind of Cairo moment. I discovered that we should much more try to invest efforts and finance in prevention in order to lower the tremendous pressure we experience in the overall system. So after the commission tabled the report, I try within the system to change or to introduce some kind of more prevention in the overall system. I was a general manager of an important regional body in Quebec, dealing with health and social services organizations, and we were planning all the system on a regional level. It was in Quebec, in the region of Quebec. Okay, and then I was born in Portneuf, the jurisdiction of Portneuf. The minister, liberal minister, Quebec minister, Michel Pagé, was a member of National Assembly for Portneuf, and he resigned at that time. So I just asked myself, why should I try to get more prevention in the overall system through politics? That's why I was elected member of the National Assembly for Portneuf in 1993. It was a by-election, and then at the general election of 1994, I was re-elected, and then up to 2003. And I really tried to work on more prevention in the system as an MMA, and I also had the opportunity to act as a Minister for Health and Services, responsible specifically for prevention and public health. Okay, but it was in 2002, and I lost my election in 2003. I was 57 at that time, and I was just thinking about, okay, what do I do from now on? Okay, so we had this idea of trying to work on the positive side of health with more prevention through the working area. Okay, organizations and enterprise that are already there. The information was quite interesting about how we can manage workplaces in order to have better health, okay, a better environment. And that's why I founded the Healthy Enterprise Group in 2004, which I chair since. And we develop a lot of ways, I would say, to introduce more and more positive activities and strategies within organizations from there on. So, and we're at the very origin of the Healthy Enterprise Standard, which was developed by the B&Q, the Bureau de Normalisation du Québec. It was in the Healthy Enterprise Group gave a mandate to the B&Q, such a mandate in 2006, and in 2008, this new standard was ready to be implemented, to be announced with all I would say the information necessary to start in an organization a structured approach and démarche in order to have a good result within an organization. So, and from there, I was also, as you said, active in the very important committee that developed the other important standard for Canada about psychological health in the workplace, which is a very interesting basis of reference for every employer interested to take into account the issues as well that we're facing when we talk about mental health within organizations.
Mm-hmm. So I remember B&Q, for those who aren't familiar with that, is similar to CSA, the Canadian Standards Association, but it is in Quebec. And when we were talking about doing this national standard, we said, well, to make it really inclusive, we need to have people from across the country, and we need to partner with B&Q to do this. And Roger, you were the person that they recommended as co-chair. And I think that we can confidently say that it's better. The standard is better for having had that more inclusive approach. But when the standard on psychological health and safety was started, the Healthy Enterprise Standard already existed. And the question was, do we need another standard? And the decision was yes. Can you speak about why you think the decision to add another standard happened?
Oh, from my point of view, it's because we're facing so much important issues when we talk about mental health, not only in a working environment, but also in society as a whole. And we were very far from evaluating mental health as a domain about which we could seriously talk and act in order to lower the problem we have in this sector. And this is why the topic is so important in C, that it is just normal to have had a specific standard for psychological in working area.
To do that deeper dive into this section, which was already included in the Healthy Enterprise Standard to look at mental health. But you were quoted in a publication I read as saying that, 10, 15 years ago, employers said, well, an employee's mental health is their business, right? It's not our responsibility if they have good mental health or not. Can you talk about how you think that might have shifted since then?
Just with the tools and the basis of information that is now available, and the structured programs that are now available, that helps employers to cope with these issues, I would say. Before that, it didn't exist. These two standards we're talking about didn't exist at all. So now you have these referential that could guide an employer in such a process to get the working environment much more healthy, I would say.
I think
so. This is why in 2004 you had these employers that told me, well, isn't it the responsibility of the employee to be in shape when he enter in my organization, And labor representative at the higher level were telling me, what? It's not the business of the employer to take care of the health of employers. And today we do not hear about that at all. Employers are much more open to consider their part of responsibility when it's a matter of health, and it's the same for the employees.
I think you've made a good point, though, is I think what has happened is we're no longer saying you're responsible for the health and well-being of every employee 100%. We're saying you're responsible for the impact that you have on them. So it's being able to describe psychosocial factors that are within the influence and control and responsibility of an employer has made that shift, right? That if I come to work and I have an addiction, it may not be the employer's fault or even their responsibility, but it is to manage when I'm in the workplace and to manage the impact I have on others as well as what the workplace has on me. So it's shifted thinking quite a bit since you started. Can you help our listeners understand how the Healthy Enterprise is different than Z1003, which is the standard on psych health and safety? And importantly, Roger, many people have asked, how do I get certified in the CSA standard? And the answer is that there is no certification process for the standard itself. There's groups like Excellence Canada that do something that approximates it. But with the Healthy Enterprise Standard, you do certification, you do audits. And so can you help us understand the difference between the two, and then why an employer anywhere in Canada might want to do it?
Well, I have first to say that the Healthy Enterprise Standard has been updated in 2020, and it is now recognized as a Canadian standard as well. So any employer interested with this standard can be certified by the BNQ, and any employer also interested by the psychological standard can use it in order to, within an overall program, using the healthy enterprise standard, to use the very important information that exists and is suggested in the psychological standard to also address mental issues within the organization. Okay, not only physical issues or whatever, you know. So these are very easily integrating standard that could be work together, I would say. And with the health enterprise standard, you're right. You have the possibility to be audited by the BNQ and then have a formal and public recognition when you're certified. And so you can present yourself as an employer, as a good employer to any employee that could be interested to work with you.
Great. And can you explain the process? I know it's a standard, so it can get very technical, but from a higher level, to people who want to understand what it would take to qualify for the healthy enterprise standard, what would they have to do?
Well, you would have to comply to send a certain number of requirements. That's it for any standard that exists. Okay, and as an example, you have to follow a process by which you first, as an example, have to get a strong commitment from the higher level of the organization about the importance of a project dealing with health and with workplace health in the organization. There are a certain number of requirements for a first level. The first level is called healthy enterprise. You have, as an example, to comply or to respect about 40 or 45 requirements. And for another level, you will have the second level is called Healthy Enterprise Elite. And the third one is Healthy Enterprise Elite Plus. You will have to respect much more requirements, up to 65, I think. The requirements like you have to, if in your project, you have to appoint a project manager. You have to get training for the member that are within the little committee responsible for the program. You have to comply to communication requirements or activities. You have to consult the staff. You have to have a very let's say participative also dynamics within the organization about this project.
It's not something you do to staff, it's something you do with them. Yes.
Yeah, exactly. So it's quite demanding, I would say, but at the same time, you have a very interesting return on investment, human investment and financial investment as well.
Is that right? What would you say is the return on investment for doing this process?
It's difficult to evaluate because it's not, as an econometrician, it's not easy to isolate this factor among a lot of other factors. But what I would call bad health in an organization can equal about 20% of the overall budget. So it's huge, you know, the impact on non-health. So you can lower a lot of these kind of costs. We have evaluation about that. I could make this evaluation, the results available if you want, but
great.
I don't remember exactly the figures.
That's great. We'll we'll put it in the notes for people. So if you send it to me, I'll include it for them.
Sure.
And so really, though, what you're describing, it is effort. It's not just an easy checkbox process, but it's what a lot of organizations are already doing. You know, they already have a committee for wellness or health. They're already training people to be psychologically safe or to think about the management system. And so doing this and going through the process can be part of business as usual with some more added on. And you had now, and I don't know if this stayed there in the update, but you had options for employers in terms of what areas they wanted to concentrate on. Is that still true? I think you had management, you had physical.
We have 4 kind of sector, I would say. First one is life habits. Okay, it's the most evident one. Okay. Second one is the work-life balance, which is very important also. Third one is the management practices, and the fourth one is the environment from a global point of view in your organization. It can deal with difficult topics like harassment, as an example. It's part of the environment, which could be very have bad effects on people. You know, it's an example.
So when you say environment, you're talking more about the culture than about climate change or pollution.
It could be both. Okay? Yes, and one is as important as the other. You know,
Mm-hmm.
but what is important is you will succeed in having interesting effects if people are participating, are I would say part of the action. You know, when you establish a kind of bilan of your organization as far as health is concerned. Secondly, what are the main problem you see in the organization, and within these list of problems, which are the ones on which the organization would be ready to move and to act. Okay, and you have to choose that first, especially in a first would say cycle. Okay, try to focus on one or a few problems which can become few opportunities to have a better portrait of health within the organization. And if you succeed to go through this process and have positive impacts, you can choose afterwards with another questionnaire, I would say, a survey on other problems you can have in the organization. It is really a progressive, I would say.
Continual improvement.
Yes.
Roger, I can't tell you the number of employers that I heard wanted to do it all at once. So using the psychological standard, they wanted to improve every psychosocial factor, and it's too much. It causes such strain. But I agree with you that just talking about it with employees, listening to them really so that they feel safe and heard is in and of itself a healthier organization, is a psychologically safer organization. So the process doesn't have to be huge and it doesn't have to be fast. It's just that engagement and participation will make it different. Now, one of the things that I'd love for you to talk about is when we did the standard on psychological health and safety, we had 30 some very strong, professional, opinionated people around the table. And yet we had a psychologically safe environment. You know, there wasn't fighting or arguing. There was discussion. There was debate. What do you think accounted for the process itself?
I do not understand your question exactly.
Yeah. So share your experience of the process to create the standard on psychological health and safety. What was your
Well,
experience of that? Yeah.
first of all, I have to say that when I was appointed as co-chair of the committee, I didn't realize that the health issues were so important. So in order to understand that, you have to get into the action. You have to hear about what are experiences of people with mental health, and listen also to experts as well as people from the ordinary world, I would say. Okay, and around the table of such a committee, it's very interesting because you have experts, you have people that come from the enterprise, the users, I would say, of the standard, and you have also people coming from employees environment, from labor representative or labor unions, and all these people share together how we could deal about the issues we're facing with psychological and mental health in workplace. And so we have the knowledge, you have the experience of the employers, and as well as employees. Okay, and this is a very interesting dynamics from my point of view, where you really can focus on what are the main problems, but also what are the solutions to the problems we can encounter in a working environment. It was for me very, very, very interesting.
Yes, I had worked in a committee before that had what they called the balanced matrix. And that's what you're talking about, where no one interest group can dominate. So you had to have a certain number from those that do policy, certain number from those who are representing employers, from those who are representing employees. And when we were first talking about the standard, which was probably in 2009, thinking about developing it, we could have just created something, but this consensus-based balanced matrix approach, not only in my mind made it better, but it also made it much more credible and practical. And one of the points of their process was public review. And I'm wondering if you remember the public review process and what you thought of the feedback that we got.
Oh, it's been some time since, indeed.
Yeah. Well, let me remind you that we had 866 comments in total, which was not expected at all for this, that many people would be interested. But do you remember some of the resistance to the standard in the beginning?
Well, one of the resistance I was in contact with was here in Quebec, because we have the Conseil du Patronat, which has the responsibility of representing the interests of the employers, I would say, of organization. They were in a very tight discussion with labor unions about mental health and what could be done or not. And when they saw that there was this project of having a new standard, they didn't agree at all, because they were afraid that it could impact the equilibrium in their discussion with the representative of employees, with labor unions, and they were quite reluctant to have that kind of basis of reference, because if it doesn't exist in laws, if it's not mandatory to take the mental health issues into account in organization, the standard becomes the basis on which we could have decisions, legal decisions in the market, So they were very reluctant about that. But no, they're doing well.
Yeah. So what do you think? I mean, the standard's voluntary, so that's one thing, but we know that it can be referenced in court cases and
Yep.
Has been. But what do you think has made it easier for that group in particular, but for others who said, we don't want it to be the employer's responsibility? What's made it easier for them to accept now?
First of all, information, okay, about how to deal about the mental problem in a working environment. The information exists, and a structured approach is available if they want to become more active about mental health in their environment. So at the very beginning, they did not know a lot about issues and solutions, but with the two standards we're talking about, the solutions are there. The information exists behind this solution and this process. So it becomes just easy,
Yeah.
Maybe I would talk about a little bit about the process we initiate in Quebec and at the group, Healthy Enterprise Group, where to go up to the standard, okay, we manage 3 steps in order to have an organization to gradually evolve towards the health enterprise standard. The first step with only 7 requirements. The second step with 14. The third one with 21, and then it's a kind of a very easy way of being able to work with a standard and have positive results.
You've made it manageable, and it's almost, we call it gamification, Roger, where you give them a reward when they've only done 7 different steps, and then you give them another reward at 14 more. And so you're helping organizations to stay motivated and to feel good about it. But you said something,
and all along the process, they become more and more confident, or
yes,
they trust more and more this kind of process, So, and when it's so simple from my point of view, this is an existing tool to work with, and more and more organizations are working with that, and so people are less and less afraid of going into or trying to integrate these processes in their own organization.
It was Senator Michael Kirby who said, don't use the stick by going right to legislation and saying you must do this. He said, use the carrot, so the reward, by letting those organizations who want to do it, show their success, and then others will want to follow. And I think it was good advice that we do that. I'm looking now at ISO 45003. So this is the guidelines around psychological health and safety related to occupational health and safety. And I know some of the folks that you and I know were disappointed that they felt they didn't go far enough. But when you think about countries all over the world who aren't where we're at now, if they started with something, then what you're talking about, building that confidence, building that trust that doing this is good for business as well as practical, that it will really make a positive difference. And so we're doing work now to make sure that the standards all align, so that no matter where you are in the world, whichever standard you pick up, it will be helpful to you. So you started off with wanting to prevent health issues for people. So to be preventative about healthcare. And can you talk about how healthy enterprise or psychological health and safety actually can help prevent health problems for employees?
Well, it's for sure that if you talk to your employees, if you have a kind of a survey asking about these issues, mental issues or global health issues, you will have answers that could guide you about topics on which your organization and your employees would be ready to work on. Okay. This is the very basic debut, okay, in an organization, altogether with the full commitment of managers about that. Okay, so it helps to focus on your strength as well as your weaknesses in the organization, and you can thereon focus on those weaknesses you feel that people are ready to work on.
As opposed to, I think back in the day, it was, let's do jumping jacks and eat apples, or we're going to do a smoking cessation program when people didn't want to stop smoking, or we're going to, it was done to the employees rather than with them. And we know just from the general public, well, we know from ourselves that we're only going to make positive changes to our health if we're ready to. We're not going to do it because someone else has told us to do it. And so talking to the employees allows you to put your efforts in the right places. But what about the
because
things?
You cannot at this time start from where they are, really.
Right.
Okay.
Yeah, start where the employees are at.
Where you want them to be.
Yeah, exactly. But there's also risks in workplaces that have negative impacts on health of employees. And the healthy enterprise covers some of those too. What are the risks that you think are most detrimental to the health of employees that are within the control of the employer?
I wouldn't have said that 5 or 10 years ago. Okay, I think it's really psychological and mental issues in organization, but that can comes from outside the organization, but have anyway an impact on the productivity, on the whatever. Okay, so I think this part of the equation is more and more important. Much more that I was thinking about a few years ago.
Originally, that we, in talking to healthcare practitioners, seeing when there's too much pressure, when there's conflict that's not resolved, when there's harassment in the workplace, when there's discrimination or stigma in the workplace, all of these cause psychological harm, but they can manifest in heart attacks. They can manifest in gastrointestinal problems. They can manifest in headaches or migraines or even backaches. And so many of these health issues begin with psychological risk, with psychological.
Exactly.
Yeah. So it's good that we're working towards changing that.
Yeah. I know that you're interested with the question of what is the evolution and what can we anticipate for the future.
Yes.
And I've just get back to a very important law that has been adopted in Quebec last year. I don't know if you know about that. It was the Bill 59, an act to modernize the occupational health and safety regime. And the bill was adopted October the 6th, 2021, and it amends the Act respecting occupational health and safety, in particular, to oblige employers to take the measures necessary to ensure the protection of a worker exposed to a situation of physical or psychological violence, including spousal or family violence in the workplace. Okay, so I know it's one of your concerns. What's next? Okay, I think it's a very important move here. It's only so employers are invited to act not only on the physical wellness plateau, but also about psychological aspect. But in this, for me, it's a first step. Only one step, but it's a debut.
It's an important step.
Yes, an important step.
And, Roger, when we, again, we're first looking at the standard, the question came up, should we just change Occupational Health and Safety Acts to include psychological? And in the general duty clause, which says to protect employees from harm, it doesn't say physical harm. So some people said it's already implicit, but people don't know what it is. And it was Maureen Shaw said, we need to segregate it, shine a light on it, and then we can integrate it. But we've got to get it separate first so that they can see what it is. And I think that's been important, that more people are aware of it now than used to be.
Sure. At the same time, I can feel some resistance.
Mm-hmm.
Okay, with the new law or the new version of the law, I know that it won't be easy to introduce that kind of way of thinking health in organizations.
Yeah.
I think that, and also the reference to the problems that could come from the family, as an example. It's outside the organization, but it has an impact. So how can we manage this kind of a situation in an organization?
Well, in Ontario, what was Bill 168 was all about that with domestic violence, that employers need to take steps. And the reason that the law came into effect was when a partner came onto the workplace and harmed or actually killed an employee. And what they're saying there isn't you're responsible for what happens in the home. What they're saying is you can't turn a blind eye. If you see it, if you hear it, if you have some knowledge of it, then you need to take steps. If somebody says that they are afraid, then you need to put things in place to protect them. And I think before it became law, it was like, well, that's not my business. It's not my concern. But if you have an employee who is at risk, then it is your concern. So those things, if you look to the Occupational Health and Safety Act, you'll see that several provinces have included psychological already. And in Ontario in particular, employers have very definite guidelines about what to do around domestic violence.
What you're saying makes me quite comfortable about the future. Can you imagine the road that we succeeded to do or to over the last 20 years?
Yeah,
it's incredible. So what about the next 10 years? It would be interesting to help and to at the same time to observe the evolution. And now we're, as you know, we're in the phase of updating the psychological standard, which will be very interesting because new information since 20 years or 10 years could be usefully integrated in this very important referential.
Well, and I think my hope is that it becomes more practical at the same time it becomes more comprehensive, more inclusive, but that it's easier for employers to use than ever before, but that it gets more to the point. Because I think one of the things about the standard was that people weren't always sure what they should do, because it can't be prescriptive, because what the police department needs to do is not the same as what the ballet school needs to do. So if we're making a standard for everybody, it's got to be a framework that then is adaptable. But what's your best vision for the future? How do you think that the standard or just psychological health and safety in general should evolve?
I can see organizations like the Health Enterprise Group work quite closely with public bodies or official bodies in the sector in order to develop some solutions or process that could be even more easily adaptable and applicable, whatever the organization, small, big, or medium. Okay. So we will have next to work with these bodies in order to try to modulate our solutions and our processes accordingly to the need of our organizations. It's not that complicated. It seems to be complicated, but it's not.
No, it's not. And yet I know in the federal government, they took the stand that you must measure psychological health and safety and do that. And so they do. But some of the feedback I've had is, but then they don't take action on it. So it's, how do we make sure that they're taking practical, manageable, and effective action? So yes, we want to measure so we know what to take action on, but then to make sure that the action helps. And, just going back to the Occupational Health and Safety Act, the reason that we didn't just do that to begin with was because if you have a joint health and safety committee, they do not have any ability to influence management rights. And so they can report on the hazards in the workplace, but they can't tell or force management to take action. And so although it's a great approach, it's not enough, because leadership also needs to be held accountable for their impact on psychological health and safety. And the Occupational Health and Safety Act falls quite short of that. So whereas the Healthy Enterprise Standard specifically includes it.
I think that it will become more and more easy to interest organization to be proactive about the health status within the organization. At one time, it became a matter of profitability and productivity, and capacity to get the best employees in your organization because you are a responsible or a good employer. Okay, so there's a part of the equation that is linked to profitability, to productivity, what we call at the Groupe Entreprise en Santé the healthy productivity, not anything,
Not just do it.
Yeah. I think we have to be we have to trust the capacity of the market to regulate part of the solution, from my point of view.
Well, that's what I say, Roger. My children, my little children who are in their 30s now, would not put up with the stress, the chaos, the confusion, the pressure that I did as an employee. because they know too much about work-life balance. They know too much about mental well-being, and they just would not endure that kind of situation. So the market, meaning the younger people that are coming in, they themselves are going to demand something more. And I don't think it's a sense of entitlement. I think it's that they're smarter than I was at their age.
Yeah, and I hope employers will get smarter as well.
That's right. That's right.
I would like to give you only an example of what I meant a few minutes ago. Um, this last August, we had to recruit 2 professionals at the Healthy Enterprise Group. So we announced these 2 jobs that were open, and on one post we received 35 applications, and on the other one 15. In a context where we are in a shortage of main d'oeuvre.
Mhm.
So
And in the past, you would have had hundreds.
yes, but a lot, yeah, a lot of employers today have. It's very difficult to have people proposing their candidature as candidate on a post. You maybe receive 2 or 3
Or
applicants
none.
or not.
Yes.
So being recognized as a responsible employers, managing a healthier working environment is very good for business.
Yes.
This
Well,
is
I
my
say to
message.
the people who work for me, it's going to be really bad for the reputation of the work I do if you burn out. So we need to have balance. That's the way I say it. But yeah, we work hard because especially in work like Healthy Enterprise or what I do, we attract people who are passionate, right? People who want to do good, who want to make a difference. And sometimes those same people don't have good boundaries, good work-life balance because they're so passionate. So it's up to us as the employer or the leader to manage that so that these good people that we invest in will be with us for the long term. Roger, I know.
And that's why last summer we had a kind of low work experience at the group, Healthy Enterprise Group, just to be aware of what you're talking about and try
what
to
was your
manage.
experience?
It was very good. It was very good, and people are not less productive because they try during this period to experience the work.
Right, right. Well, I know when I burned out, I was working really hard, long hours, but since I will never burn out again, I've decided my work is better. So working long hours and being stressed doesn't make for better work, is what I learned the hard way. But at the time I thought it was. Roger, we're running out of time, and I want to ask you to describe what a psychologically healthy and safe workplace would feel like to somebody who doesn't know what we're talking about. So not the definition, but what would it feel like to somebody who was in a place like that?
Oh, it's a place where you can talk about mental issues without being considered as a weird person or colleague. Just normal. It's part of it. It's part of life.
Yeah, it just becomes a very straightforward thing that everybody's well-being is considered and discussed. And
exactly.
Very simple. Any last bits of advice you want to give to people who are contemplating whether or not to go through the process of the Healthy Enterprise Standard?
Oh, don't be afraid. It works.
Yeah. Great. And how would they get in touch with you or with the folks there if they were interested?
Oh, it's easy. Just just write on your computer Groupe Entreprise en Santé, and you'll have all the information necessary. No problem.
And is that the same website, that same one for both English and French?
It's mainly in French, but I'm working nowadays on an English version.
Okay.
Yes. So maybe in December.
That's soon.
Yes, will be available in both English and French. Yeah.
Great. So I will also put that link. You're going to send me the evaluation information, and I'll put that link in with the podcast information so that people can find it and be able to act on it. So, Roger, thank you so much for your time. I knew that it would be really easy to keep talking about all of the different things that you've done and the journey that you've had to help people prevent the worst health effects and really lead healthier, happier lives, but also improve working lives. So thank you for all of that. And for the listeners, if you want to subscribe to the channel, you'll be able to hear this and many other podcasts on psych health and safety in Canada. So thanks to Flourish DX for supporting this, and we'll talk to you again.
You've been listening to the Psych Health and Safety Canada podcast. To stay up to date with the best content on workplace mental health in North America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.